Uh, Hello and welcome everyone to COVID Data Roundup, exploring COVID-related data from ICPSR's archives. We're delighted to have you join us today. I'm now going to introduce today's speakers in the order in which they will present. Megan Chenoweth is the Data Project Manager for the Social, Behavioral, and Economic COVID Coordinating Center and the National Neighborhood Data Archive. Sara Britt is the Data Project Manager for the Health and Medical Care Archive and the Patient-Centered Outcomes Data Repository. Brenda Mihishi is the Data Project Manager for the Child and Family Data Archive. Sarah Rush is the Data Project Manager for Data Sharing for Demographic Research. And Dominic Bonanni is the Data Project Manager for the Consortium Archive Team and Open ICPSR. I will now hand it over to Megan to get things started.
Thanks, Chloe. Forgive the errant mouse just now. Well, welcome everybody. We're very happy to have you here today. I'm going to give you just a quick introduction to what we're going to cover today. So to start, I'm going to give you a high-level overview of ICPSR's data holdings that are related to COVID, just to give you a sense for the breadth of what's out there. That's our kind of view from the surface. And then my colleagues and I are going to take a deeper dive into a few key COVID-related data resources from ICPSR. Each of the studies that we're going to talk about in detail comes at the pandemic from a little different perspective, sheds light on a different topic, but together these examples are meant to give you some highlights of the kinds of questions you can ask about the pandemic with ICPSR data. And then finally, when we wrap up, we're going to show you where to find links for all the studies and resources that we talk about today, as well as how to keep in touch with us. All right, so let's start with that high-level overview of COVID-related data that you can find at ICPSR. So here at ICPSR, we currently hold more than 350 studies that are related to COVID. Some of those studies are brand new data collections that were initiated during the COVID era to address a research question that's directly related to COVID. So that might be COVID case counts, or it might be public opinion polls specifically focused on COVID. On the other hand, we also have a number of longitudinal or panel studies or administrative statistics that have been ongoing for years, but that have incorporated questions about the pandemic's impact into their data collections. ICPSR also maintains a social science variables database that lets you drill down into the variables within our curated data collections. And there are about 7,300 variables within ICPSR curated studies that pertain to the COVID pandemic in some way. And then finally, ICPSR also maintains a bibliography of data-related publications that illustrates how our data has been used in the published literature. There are currently about 400 publications in the bibliography related to COVID in some way. And searching the bibliography can be a particularly good tool for finding studies that may not be directly relevant to COVID itself, but have been used to investigate COVID-related research questions. You can use ICPSR's data to explore the pandemic, explore the impact of the pandemic on a lot of different topics, as I'm illustrating with this word cloud. So for example, you'll find many studies related to the economic impacts of COVID. So for example, the pandemic's impact on consumer attitudes, consumer expectations, expenditures, investments, and income. You'll also find health-related data here at ICPSR. So for example, data on healthcare access, health attitudes, and vaccines. ICPSR has data that can be used to investigate COVID's impact on substance use behaviors. So, for example, changes in patterns of use of tobacco or alcohol or marijuana or e-cigarettes. And there is also data that sheds light on COVID's impact on vulnerable populations, such as children, older adults, and racial or ethnic or sexual and gender minorities. In which of ICPSR's thematic collections should you look for COVID data? You can look in lots of them. The largest number of studies directly related to COVID can be found in our COVID-19 Open Data Repository. This is a free and open repository accessible to anyone, where any researcher can deposit COVID-related data and make it available immediately. That said, that is not the only place at ICPSR to look for COVID data. Another large group of COVID-related studies can be found in our consortium archive, which is our largest repository of curated data that is available for free to people affiliated with one of our 800 plus ICPSR member organizations. In addition to that data, you can find curated data in several of our other thematic collections, including NACJD, our criminal justice archive, NADAP, which focuses on substance use and HIV data, NACDA, which is our aging archive, and several other thematic collections that you're going to hear from today. Much of this data is free and openly available to anyone. But fortunately, you don't really have to know which collection houses the data you're looking for. You can just search ICPSR's catalog of data holdings and find all of the studies, variables, and data-related publications that are relevant to your topic of interest. All right, so that's the big picture view of COVID data at ICPSR. So it's time to dive deeper into a few key studies from each of our archives. And just to reiterate, at the end of the presentation, we're going to share a QR code and a link that has links to each of these studies so that you can explore them further. So if, as we're going along, there's one that in particular that catches your interest, no need to scribble frantically or try to search ICPSR's data catalog to try to find it in the moment. We will share links to all of these studies at one QR code at the end of the presentation. All right, so I'm going to take the first couple of studies in this list, and the very first one that I want to highlight is the U.S. COVID-19 County Policy Database, which comes from the Social, Behavioral, and Economic COVID Coordinating Center. So there's been a great deal of research done during the COVID pandemic on COVID mitigation policies, both their intended outcomes, did they do what they were meant to do, and the unintended consequences, what happened along the way. So for example, these are policies like school and business closures, mask requirements, and eviction freezes, among others. So for example, researchers have asked questions like, do mask mandates result in fewer COVID cases? Or did long school closures lead to higher levels of drug and alcohol use among teens, for example? In a lot of these research studies, researchers have used data on policies implemented by states, so at the state level, but we also know that many counties in the United States also implemented their own local policies. So for a full picture of the policy landscape, we need to look at not just what's happening at the state level, but also at the county level. And the US COVID-19 County Policy Database is a really important tool for this. It contains information on policies implemented not just by all 50 states, but also by 309 counties in the United States as well. Those 309 counties are admittedly about 10% of the counties in the United States, but they cover about, I believe, a little more than 50% of the US population. And the counties that you can find in this database are diverse with respect to geography, the race and ethnicity of residents, and the political climate of the county as well. The team collected data weekly between January 2020 and December of 2021. So this is a very granular look at what changed over time policy-wise, and this data is free for anyone to download. Okay, the next study I want to highlight contains measures of essential workers by census tract and zip code tabulation area, and it can be found in the National Neighborhood Data Archive. One of the things that we learned during COVID is that the workplace is a driver of infectious disease risk for individuals and for communities as a whole. And in particular, workers who were deemed essential experienced higher rates of COVID infection and hospitalization and death. Researchers who are interested in exploring the implications of having high numbers of essential workers in a neighborhood on overall infectious disease burden might be interested in this study. So simply put, this data is capturing the proportion of employees in a neighborhood who were employed as essential workers in 2020. So by essential workers, we're including workers in healthcare, construction, transportation, food preparation, cleaning and maintenance, and other essential industries. Neighborhoods are quantified in two different ways in this data, at the census tract and the zip code. So the data contains both the absolute number of essential workers in a tract or zip code and a proportion of essential workers to all workers to adjust for population size. So you might use this data to look at the neighborhoods themselves, or it could be also linked to geocoded data on individuals. So for example, maybe a survey response or a medical record that includes a person's census tract or their zip code. And you could do that to look at the neighborhood impacts on individual health outcomes. Okay, so this data covers the entire United States and is free for anyone to download and use. All right, and I am now going to hand it over to my colleague, Sara Britt, to talk about the next study.
Thank you, Megan. So this first COVID-19 series comes from the Health and Medical Care Archive. It is the data archive of the Robert Wood Johnson Foundation, and their goal is to build a culture of health by increasing the understanding of health and healthcare factors that contribute to health in the United States through secondary analysis of the RWJF supported data collections. Data in the HIMCA collection is freely available. So specifically, in the context of COVID-19, RAND and RWJF partnered to build from an existing survey called the National Survey of Health Attitudes. They implemented this longitudinal survey to understand how health views and values have been affected by the experience of the pandemic, with particular focus on populations deemed vulnerable or underserved, including people of color and those from low to moderate income backgrounds. This series comprises 4 waves of longitudinal data collection. It included 2 populations, a sample of populations at greater risk and a general population sample. Each summary for each individual study tells what particular population or populations are included in that release. And while the questions in the survey were largely similar across all 4 waves, individual summaries contain information about special focuses that each wave had. Questions in this COVID-19 survey focus specifically on experiences related to the pandemic, financial, physical, and emotional, and how respondents viewed the disproportionate impacts of the pandemic, whether and how respondents' views and priorities regarding health actions and investments were changed, including the roles of government and private sector, and how general values about such issues as freedom and racism may be related to pandemic views and response expectations. Next slide. The next 2 studies that I'm going to talk about come from a different archive. They come from the Patient-Centered Outcomes Data Repository. And it is the place to discover, access, and analyze comparative clinical effectiveness research collected through studies funded by the Patient-Centered Outcomes Research Initiative, or PCORI. So for this study, it sought to test whether it sought to look at nursing homes and how they had been devastated with millions of COVID cases and hundreds of thousands of COVID deaths. They were ill-equipped for the pandemic, though facilities are required to have infection control staff. Only 3% had taken a basic infection control course. Significant research has focused on infection control in acute care settings, but little is known about the implementation of practices and effective interventions in nursing homes themselves, which is why the study was created. And the researchers proposed an intervention using Project ECHO, which is extension for community health outcomes. It's an evidence-based tele-mentoring model to connect experts with remote nursing home staff and administrators to proactively support evidence-based infection control guidelines and implementation. The study sought to answer the critical research questions of how evidence-based infection control guidelines can be implemented effectively in nursing homes in general. Next slide. The study focused on testing whether the stress first aid sites, or SFAs, improved the well-being of healthcare workers compared with care as usual for healthcare workers who deliver care in hospital and ambulatory healthcare settings. Researchers conducted interviews with site leadership, site champions, and healthcare workers to describe the experiences of the healthcare workers receiving the training, as well as to understand the resources available in usual care and how the SFA was implemented. Both of the last two studies I spoke about were restricted access, so you have to apply, but otherwise they are freely available as well since it's funded by PCORI. And now I will pass it to my next colleague, Verinda.
Okay, thanks, Sarah. As previously mentioned, I work at the Child and Family Data Archive, or CFData, which is the place to discover, access, and analyze data on early care, education, and families. One such study housed at CFData is the National Survey of Early Care and Education, or NSECE, conducted by NORC at the University of Chicago. The 2019 NSECE is a national survey on childcare supply and demand. It includes 4 integrated nationally representative surveys of households with children under the age of 13, home-based providers of early care and education, center-based providers, so that's places such as daycares or preschools, for children not yet in kindergarten, and then the center-based workforce. In light of the pandemic in 2020, NORC conducted the NSECE COVID-19 longitudinal follow-up and re-interviewed some participants from 2020 to 2022 in order to describe the COVID experiences of the 2019 early care and education supply and workforce. This study has some data files that are publicly available and some that are restricted and require an application to access. Because the archive is funded by the Office of Planning, Research, and Evaluation within the Administration for Children and Families, all of our data are available at no additional cost. Next slide, please. CFData also houses several studies focused on data from the Head Start programs for children 3 to 5 years of age. The Head Start Family and Child Experiences Survey, or FACES, is a sample of Head Start programs and centers nationwide, their classrooms and children and their families. 2 studies within the series include data collected during the pandemic. So the FACES 2019 study and the American Indian and Alaska Native, or AIAN, FACES 2019 study, which provides information about children attending Head Start programs operated by federally recognized tribes. The data describes how services and staff were impacted by the pandemic, including what additional resources were available for families and staff at that time. Additionally, 2 new studies will be released later this fall, reflecting the 2020 to 2022 collection years. So these studies contain a lot of interesting COVID related information. So if you are interested, we encourage you to sign up for our listserv. And I think a link is included in the link tree that Megan mentioned earlier. And you'll get an alert when the data are released. But please note, due to low response rates in the spring of 2020, we do not encourage cross-study analysis with these new data sets and prior FACES studies. These data are restricted and require an application to access. There are additional requirements in place as well for access to the AIAN FACES data, including a committee approval by an AIAN committee. So please see the study homepage for more information on that. Now I will pass it over to Sara Rush.
Thank you, Brenda. Data Sharing for Demographic Research, or DSDR, is a population health data archive supported by the Eunice Kennedy Shriver National Institute of Child Health and Human Development, also known as NICHD. Today, I'll be focusing on NICHD-funded studies, beginning with Baby's First Years. The overall goal of the Baby's First Years project is to provide the first definitive understanding of the extent to which household income plays a causal role in affecting children's cognitive, socio-emotional, and brain development early in life for children born to low-income families. The sample includes 1,000 mothers who gave birth at one of 12 hospitals across the study sites, who were recruited into the study and received a monthly cash gift of $333 per month or $20 per month for the first 52 months of their child's life. Baseline, age 1, age 2, and age 3 quantitative data are available for download through DSDR with agreement to the terms of use. We expect the age 4 data to be available in early 2025. The age 6 data collection is ongoing, and the age 8 data collection is planned for 2026 to 2027. And both the age 4 and age data are expected to be deposited with DSDR as well. Variables in the data relate to aspects of family life hypothesized to be affected by poverty, such as parent stress, family expenditures, family routines, parents' time use and parenting practices, and child care arrangements, as well as variables related to the child's development, physical health, stress, and behavior. The majority of COVID-specific measures are available in the age 2 data file and relate to household members' job loss, income loss, COVID diagnosis, hospitalization and death, changes in behavior resulting from COVID precautions, and social distancing practices. Next slide, please. The Future of Families and Child Wellbeing Study, or FFCWS, is an ongoing study for which the public data are available at 7 time points from birth through the age 22, and this is available through DSDR. Some of you may be familiar with FFCWS in its former name, which is the Fragile Families and Child Wellbeing Study. This study follows a cohort of nearly 5,000 children born in large U.S. cities between 1998 and 2000. It oversampled births to unmarried couples, and when weighted, the data are representative of births in large U.S. cities. The core survey data were collected from interviews with mothers, fathers, and/or primary caregivers at birth, and again when the children were age 1, 3, 5, 9, 15, and 22. The child interviews began at age 9. Variables in the core survey relate to health and health behaviors, for example, fertility, history, mental and physical health, parenting, childcare, finances, such as child support, household earnings, individual income, and employment, housing and neighborhood characteristics, legal system involvement, quality and status of romantic relationships, family and social ties, and cognitive and behavioral development of the child beginning at age 1. The year 22 data and the COVID-19 study of adolescent neural development, or SAND, covered items specific to the pandemic, such as the pandemic's impact on work and employment, social activities, social support, finances, well-being, home life, mental health, and physical health. Next slide. The final study I'll highlight today is the National Couples Health and Time Study, or NCHAT. This is a nationally representative, multi-method study of cohabiting and married individuals ages 20 through 60 who are in a same or different gender relationship during the pandemic. The study includes survey and time diary data from main respondents and their partners. All of the partner survey and time diary files are restricted. There are also restricted versions of the main respondent survey and time diary data, which includes variables that were recoded or masked in the public version of the data. NCHAT variables relate to relationship functioning, emotional regulation, discrimination, racial trauma, physical health, psychological well-being, health behaviors, stressors, and time use. COVID-specific measures relate to testing and test results for the main respondents, their partners, and other members in the household. I want to note that the IPM state-level contextual determinants of health measures are also available through DSDR for use with the NCHAT restricted data, and we are currently working to make the county-level measures available as well. And I will pass things over to my colleague, Dominic.
Thank you, Sarah. ICPSR's Consortium Archive is one of the largest data collections at ICPSR, with health science, social science, and a wide variety of other data. One of the most prominent social science study series within the Consortium Archive is the American National Election Study Series, or ANES. The goal of the ANES social media study that we have highlighted here was to focus in on the impact of COVID and the resultant economic effects on voter behaviors and opinions during the 2020 and 2022 elections, while also analyzing differing perspectives on social media usage and the reliability of COVID information on social media, amongst other factors. The study consists of data from 3 surveys. One wave of data was collected before the 2020 election, one wave was collected after. There's also a wave of data collected after the 2022 midterm elections. These repeated measures help track changes in respondent behaviors and perspective over the course of these 2 elections. So if you're interested in accessing this data, this can be accessed by ICPSR members for free if you belong to one of our over 800 member institutions worldwide. Other researchers can also access this data for a small fee. Within these data sets, some of the data files are restricted. Those restricted files are available upon request at no additional cost. Next slide, please. All right. Another ICPSR resource that can be helpful is ICPSR's self-publishing database, OpenICPSR. Within OpenICPSR, we have a special enclave dedicated to COVID data called the COVID-19 Data Repository. So this particular study within the repository, called CoronaNet, utilized a multidisciplinary approach to track government responses to the COVID pandemic between December of 2019 and July of 2020. There are over 500 scholars who have worked together to analyze over 20,000 separate policy announcements. And the goal with this study is to analyze government policy and how those policies work by examining the following metrics: the level of government response to the COVID crisis, national, regional, state, local, or municipal, specific actions that were taken, for example, travel bans or investments in the public health sector, the specific geographical areas that were targeted by these policies, who or what those policies targeted, for example, different COVID materials that were being constructed, such as ventilators or masks. The compliance mechanisms that were utilized to enact these policies, for example, whether these were mandatory or voluntary. And finally, the timing of these specific policy responses to trends within the COVID epidemic. If you're interested in accessing these data sets, you can do so for free with no restrictions and no cost through Open ICPSR. That's all I have for today. I believe Megan has a couple more things before we end today's presentation.
Yep, that's right. Thanks, Dominic. Thank you, everyone. I hope that all of our attendees have enjoyed this tour of a few of ICPSR's COVID-related studies. As promised, here is a QR code and link for if you would like to dive even deeper into any of the studies we discussed today. You can find links to all of the studies in the link tree for this session, which you can access with this QR code. Get your phone out. Or at linktree.com/ICPSR-COVID. On the link tree, you'll find two things. You'll find links to each study, and you'll also find links to subscribe to the mailing lists of each of the speakers that you heard from today. Also, I hope that you will check out the links to ICPSR's social media and follow ICPSR on the platform of your preference and spend some time exploring our COVID data resources on your own. Well, thank you for joining us today. I'm going to stop the screen sharing and hand it back to Chloe from here.
Okay. We will now take questions for presenters from the chat. Feel free to type and submit your questions in the Q&A box at the bottom of the Zoom screen. I do see one question already, and I believe this is for Megan, but anyone can answer this question. It is, does the COVID-19 policy database also include tribal policies?
Yeah, thank you. That's a great question. To my knowledge, no. But if you would drop us an email or drop your, I'm trying to think the best way to get contact information, we can check on that and get back to you with a more detailed answer.
There's a follow-up to that question, also asking if the CoronaNet database contains tribal policies.
I'm taking a look right now. I'm not seeing anything about tribal policies specifically at this time, but yeah, no, that I'm not seeing anything at this time.
Thank you. Brenda touched on this question that I'm going to ask next during her presentation, but I wanted to ask if any archives have forthcoming data releases later this year that might be relevant to COVID.
Yes, thanks, Chloe. We do have a couple upcoming studies coming out this fall that I had mentioned. So in continuation of the FACES studies, we have the AIAN 2021 to 2022 study and the FACES 2021 to 2022 study that collected data at that time. But also to answer the previous user's question, CF Data has a database called the Child Care and Development Fund Policies Database that might be of interest, that does have some tribal policies from 2021, 2022. So that might be worth checking out as well.
The Coder also has some COVID-19 studies coming out this fall, comparing ways to monitor patients with COVID-19 at home is one of them that I know will be released in the next month or so. And we have comparative effectiveness of single site and scattered site permanent supportive housing on patient-centered and COVID-19 related outcomes for people experiencing homelessness, which will be coming out later this year as well.
Thank you both. My next question is, how would a researcher who's collected COVID-related data go about sharing the data with ICPSR? And this is for anyone who would like to answer.
So when it comes to sharing the data with ICPSR, we work closely with NIH, and we have some specific resources for depositing data through NIH. Let me go ahead and pull up the link for you here. All right, I went ahead and that is now in the chat. So we have a whole page here. Since NIH has data sharing requirements, if that is something that you're interested in, where you're interested in depositing data with us, we accept a wide range of data, whether it's through the consortium archive or through other archives at ICPSR. We can help you find the best fit for your data and set up meetings with you to determine what that might be. On the NIH page that I shared, there are multiple steps that you can take if you're interested in sharing your data, and there are some links and resources provided there as well that kind of describe our process a little bit further. Yeah, and I can answer any other questions that come up about that as well.
Just gonna give it one more minute to see if anyone else would like to enter questions into the chat before we wrap up.
I just wanted to mention regarding data sharing practices specific to NIH. There is also a talk today at 3:30 related specifically to data management and sharing plans. So we invite you to join us for that as well.
Thank you all for attending and have a wonderful day.